Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello everyone, welcome to today's edition of Your Health Matters. I'm Dr. Tasila Tembo Peters. In Zambia, we have a rising incidence of mental illnesses due to alcohol abuse. On the program today, we have an expert, a psychiatrist from Chainama Hills College, Dr. Wakas Sheikh, who will explain in more detail about mental illness due to alcohol abuse. Before we go into details from Dr. Sheikh on what alcohol abuse is like, let us get public views on the topic.
Alcohol abuse is there in Zambia, especially among teenagers.
Why do you think it's common among teenagers? Why is that?
I think peer pressure is one of them, and also maybe lack of knowledge about alcohol.
Teko ture nwa fi just now out. Kula nwa ureshwele fore no bwalo. Not na nwa na lala panchi paria. Shamanke ngo muntu. Nano namba kula tukana shamanke ngo muntu. Nano namba luburi nishinshiri muntu. Ngati ubwaru wabula kusenda muri ya style better you stop.
Alcoholism is a term which is now considered as a term which is stigmatizing. So we don't usually use in our technical languages here in the medicine. The term we use is the alcohol-related health problems or alcohol-related mental health problems. So these are the problems which come due to the use of alcohol, And unfortunately in Zambia, these problems, they are on rise. Every year we check our statistics, these problems keep on rising. So like this year, almost 40% of the admissions we have in our hospital, they are due to alcohol-related mental health problems. And if you look at only males, because these problems are more common in males. So if you look at only male admissions, it can reach up to about 70 to 75% of the admissions in the male ward we have, they are due to alcohol-related problems. Alcohol basically can affect any system of the body. There are physical problems like, you can have stomach problems, you can have ulcers, and patient can present with cirrhosis or shrunken liver, or they can present with fatty liver disease. And it can affect the pancreas, where the patient can develop diabetes, they can develop heart problems. The mental health problems which are related to alcohol, mainly there are two types of problems: alcohol use disorder and alcohol induced disorder. So alcohol use disorder, there are two mainly: alcohol abuse and dependence. And then there are alcohol induced disorder. Among them there are so many, there are different disorders which can come which are induced by the alcohol, like mood disorders, anxiety disorders, depression, and so on. So when it comes to the alcohol use disorder, when people start using alcohol too much, we call it alcohol abuse, which means that they are using it no more than the normal or socially acceptable limit, and then they start having problems. And when they cross the abuse, they become dependent. What dependence means is that these people know their bodies are so much used to alcohol that they cannot function without alcohol. I'm sure you have seen people around you, those who need early morning drink. So these are the people who are dependent on alcohol. In another type of drinking we call binge drinking. Some people, they may not drink daily, but once they start drinking, they can end up finishing 20 bottles of beer at a time. But that is also a problem, If you are drinking daily or once in a while, you take 2 bottles of beer or 3 maximum, you can control it. But again, unfortunately, alcohol is an addictive drug. So once you start drinking, you may not be taking more. But a time comes when you start increasing your level of alcohol because it's not giving you the desired effect. And some of the drinks, like these illicit drinks, you may not even know their alcohol contents. The alcohol content is very high, but you don't even know what alcohol content is inside. So those are even more dangerous.
Nangwine fe obwado yo in first day. Kachero kakaina na shire umfafe umutu wefidia. Umutu wakaripaka ipana mkubeba ine guys sinimvira mushe so and then basanji bacha nyangova so kumwa muna bumbi futi. Na isa ngwamwa paka ndebelera kai bare nkoseresha. Ayo na shire sankwacha. Na isa kosa nomba narisaba addicted ku nankani ku kuli alcohol as well as asata mpoko yuzinga kono tufaka tufaka twini so nasaba addicted yakutira tinganshi wamfeshe fide ma substance mumbili mwandi share chita function bwino.
One of the biggest problem is when people start drinking, they have no control over themselves. So they start showing violent behavior and they involve themselves in the fights. So these are the people, majority of them, especially over the weekends, Friday night, Saturday night, if you are here, you'll see those patients being brought by their relatives. So once a person who is dependent to alcohol, he wants to stop or he wants to reduce his amount of alcohol, there is certain withdrawal symptoms which they can get. So then they come to us with these withdrawal symptoms. So I can give you the example, like they can be shaking, their pulse rate, temperature, BP can be high, they can be sweating. Some of them, they can develop even fits, what we call seizures, okay? They can develop generalized fits in the withdrawal stage. And some, they can start hearing voices or they can start seeing vision which not actually exist. Some, they can start feeling like insects are crawling on their skin. So those kinds of feeling. Then in the worst stage of the withdrawal, which is very severe, they become confused. We call it delirium or confusional state due to alcohol. So they don't know where they are disoriented, they are confused totally. Yeah, you see, when someone they are dependent on alcohol and they want to stop, it's not a very easy thing to do. Okay, I have to be very honest with you. So they need medical help at that stage. They can't, if they want to do it at their home, it's quite difficult. They may have problems, they may have challenges, and they may not be able to do, and then they again go back to drinking. So that's where they need medical help. There are certain drugs which we use when these people come with withdrawal symptoms. They have similar properties like alcohol. So you can give them in our controlled environment and in controlled dosaging, So we replace alcohol with those drugs. We call them benzodiazepines. Okay, I'm sure you have heard about Valium, so those kind of drugs. So we give them for about 1 week to 10 days. We start them on high dose and then we start reducing, and within 10 days, we stop them. That helps them come out of those withdrawal symptoms. And then after that, there are different ways again to deal with them. Once they are out of withdrawal, this is the time when we introduce counseling. We need to find out, it depends from case to case, why somebody is drinking. Okay, group therapies, there are these people, they come and share their experiences, their families are involved in their management. So those kind of things, those psychological interventions, that is when we introduce them. If somebody has just started drinking, I think I would like to appeal to them that please be careful. This is a thing which is very addictive, and you will not even know by the time you will reach from very short socialized drinking to the dependence level. So be careful. Looking into the facts, they should analyze what they are doing and decide themselves. Is it giving them problems, or is it giving them, or is it helping anything out? So that's when they can come to us for help.
Well, viewers, you have heard. If you or any member of your family or friends is faced with a problem of alcohol abuse, know that help is available at any of our health facilities across the country. This has been Dr. Tarsila Tembo Peters. From me, it's Stay Healthy.
It matters, your health matters, yes, it matters, oh, whether you're a alone.